Funding provided by Hartford Healthcare Behavioral Health Network.
It's been 9 months since COVID hit, and let's face it, we're all stressed. We're living through a global health crisis that's affecting nearly every aspect of our daily lives, and we don't know how long this will last. I'm Diane Orson. This is Cutline. As the virus surges across the U.S., the Centers for Disease Control and Prevention predicts it could leave 250,000 Americans dead by the end of November, and then winter arrives. As we consider the cost of the pandemic in lives lost, jobs lost, let's also bear in mind the toll on our individual and collective mental health. Coming up this hour, we'll explore the impact on Connecticut residents who share their personal stories. And we'll hear from experts with perspective and tools for building and strengthening resilience as we all navigate this unprecedented moment. We begin in Stamford, Connecticut, and meet one of the healthcare workers on the front lines of one of the most stressful medical crises in recent history.
My name is Marie Masestovic. I live in Stamford, Connecticut. I'm 46 years old. I currently work at Stamford Health as an infection preventionist. It involves oversight of infection prevention control protocols and policies to ensure we prevent the spread of infections to patients, to visitors, to our staff. I'm originally from Bosnia and Herzegovina, former Yugoslavia. I've been in the United States for about 27 years now. My passion for healthcare nursing actually kind of rubbed off of my dad. He is a veterinarian. He's also a professor of microbiology and research scientist now. I think early on when we heard that there's this virus, in China, we started gearing up for, what policies we're going to put in place, signage, prepping with personal protective equipment, educational programs. But it kind of hit us so quickly and so, dramatically that I don't think any one of us were ready for what transpired in such a short period of time. In the good old times prior to COVID, we're always teaching and coaching people, when using personal protective equipment, it's one-time use. You go into a patient's room with a mask, and when you come out of the room, you throw away the mask. But when COVID hit, even though we thought we had plenty of PPE, our materials management team was trying to get PPE from wherever they could. We didn't have enough for the volume of patients that we had, and then we couldn't get any. We tried and we couldn't get any. And so here we are, trying to say to the healthcare workers, you can wear this mask, but unfortunately you have to wear it more than once. And so I have never had such anxiety and stress, and I felt like when I come home from work, I was out of my body. I can't even explain that feeling. I just felt like I had chills all the time. I was telling my coworkers, I hope I'm not getting sick. I hope I don't have COVID. I had this heavy feeling on my chest all the time. I have asthma too. And so during this time, I became so uncomfortable in my chest and so short of breath. I thought I had COVID. I called my, pulmonary physician, and we did, Skype telemedicine, and I had asthma exacerbation, stress-induced. I've never had asthma exacerbation in the last 20 years. I had to be put on steroids. This was all stress-induced. Had a family member, also very close family member, who was in a hospital with COVID. Not knowing whether they're going to make it was such a burden on our family. I really don't know. It was all a blur, and I don't like to think about it. It was just like I was in a twilight zone. That's how I felt. And we put together what's called a playbook. So when we get into the second wave, we have something documented that we can now just turn the switch on and we're ready to go. Staff seem to be more relaxed as they know now what to do. They know what to expect, and they have had experience with these patients. And I feel that anxiety is much less because we have things in place.
It's not surprising that a pandemic would heighten levels of stress, especially for healthcare workers on the front lines, those who put their own personal health and safety at risk caring for patients with COVID-19. But there are other less visible threats medical workers face, including the impact of chronic or delayed onset mental health issues as they grapple with prolonged exposure to high levels of stress, anxiety, and trauma. I'd like to welcome into our conversation infection preventionist Marima Sestovic. Glad to have you with us.
Very happy to be here.
And Dr. Jacob Teebs, a clinical community psychologist, professor of psychiatry, child study, and public health at Yale University, and chief of psychology at the Connecticut Mental Health Center. Thank you for being here.
Glad to be here.
Marima, we're speaking as the U.S. has set a grim and staggering milestone with more than 120,000 new COVID cases in a day. Connecticut is also seeing the number of towns in the red zone spike up, including your hometown of Stamford. How are you coping and preparing both professionally and personally for what's ahead?
Well, professionally, we have been doing this, or I have been doing this with my team. We've been gearing up for this from the beginning of the first wave, and getting ready with protocols and policies in place. With gearing up for having enough personal protective equipment. But the anxiety actually never stopped, and so. Just trying to hold it together. My role is really to, protect the staff, protect the visitors, protect the patients. And so when I'm on the front lines with my coworkers and, clinicians at bedside, I try to keep it together. I try to have a smile on my face because I am trying to reassure them that everything is going to be okay. They have to have some, somewhere to go that somebody can tell them that they will be safe, they will be okay with, the PPE that we're providing, with the protocols that we have in place. So I'm holding it in with a smile on my face, and so is my team. And, but then of course, go back to my office or I come home and sometimes I crash. The anxiety continuously stays and the stress is still high. Seeing an uptick. Also, when I come home, my kids are asking me, are the schools are going to close? They're worried about that. I'm worried about that my husband and I will have to go to work and we're leaving our kids alone again, schooling wise. So that feeling at my chest stays all the time. But I'm also trying to put a front in front of my children that they're going to be safe. So, but I have to tell you, it's been quite a challenge to hold it together for such a long time, especially in the role that I have.
Jack, you are involved with town halls that have involved thousands of medical workers describing some of the challenges they're facing. Can you tell us about these town halls?
Sure. For the past 8 months, we've been doing interactive stress and resilience town halls to support healthcare workers throughout the state that are in some way affiliated with Yale, but also broadly throughout the state. So the Yale New Haven Health System partnered with the School of Medicine to support their hospitals throughout the state, as also into Southern Rhode Island, also Yale affiliated other hospitals throughout the state, and practice groups throughout Connecticut, Southern Rhode Island, and parts of Westchester County, New York. Our interactive town halls provide an opportunity for healthcare workers to talk about the stress they're experiencing and to share the resilience strategies that they're using to cope with that stress. They're usually run by a faculty psychiatrist or a psychologist, usually as a team. And our goal is less to do teaching about it, but to hear and create a safe space for people to share their own experiences, and so they can get mutual support as well as information to help them deal with it better.
And what Marima has just shared, is that the kind of story that you're hearing?
Very much so. Very much so. There's so many different levels of stress. There's certainly early in the pandemic, the uncertainty about what we were facing was a significant source of stress. That level of uncertainty has given way to other kinds of uncertainties, such as schooling and childcare and unemployment and the other kinds of daily stresses that have been caused by this pandemic and its impact on people. There's been significant stresses because of the disparity among Black, Hispanic, there's also Native communities, but we don't have as many in Connecticut. That has been because of this pandemic, that has also come into the town halls. And so there's really been opportunities for people to share their own experiences and how they're doing with this.
And what are some of the strategies that you've heard?
Well, I think one of the things that we've learned, this is really hearing from other people, but also we've learned from the research literature. A big thing that people are doing is they're learning to practice acceptance. This is acceptance of themselves, acceptance of other people, acceptance of the situation, focus on what is possible right now. It's things that they can attend to right now. Other things that people are doing is building and growing their social connections, connecting with others to give or receive support, and also for enjoyment. It becomes a very important way of coping. People talk a lot about self-care, exercise, eating properly, using meditation, people who go to faith communities, prayer, relaxation. Those sorts of things are very important for people, better sleep in terms of self-care. So in addition to that, a large group of people are talking about going out and doing things, sometimes rediscovering old hobbies and skills, trying new things. A significant percentage are now trying to do things that involve addressing issues of social injustice. That gives them some hope during a very difficult time that has multiple kinds of stressors going on in addition to the pandemic.
Marima, what do you do?
So I've done kind of a variety of things. We've focused as a family doing things together more now that we're more in the house, forced to be in the house. My teenager would like to be off and doing things with her friends, but now she has to be with us. But that's a good thing. So we've done games as a family. We have gone hiking, and that has become kind of our hobby. We'll try to find new hiking places because you're alone, you're away from people, but it's still very enjoyable. I try to do a little bit of meditation, deep breathing when I can. I close the door, close my eyes. I listen to music a lot. Music gives me hope. It gives me energy. And so I go inside my car and I blast the music on my way to work and back. And sometimes I sit in my parking lot or take a drive around when I feel so pent up and stressed, as I don't want my children to see this. Because, sometimes you lash out because you're just so overwhelmed. So these are some of the things that I've done. But it's been difficult because of the role that I have and my inability to be home as much because I'm more at the hospital trying to get the hospital through this. It's been challenging.
Can you talk about how you talk to your children about this?
Well, I have a 7-year-old and I have a 14-year-old. So the way I speak with my 14-year-old is very different than how I talk with my 7-year-old. My 14-year-old has been, teenagers, has been very closed in, and this pandemic has kind of made that worse. And so I try every day to spend some time before bed and talk openly what's happening. Tell her what mommy is doing in the hospital, but also tell her from a standpoint of good things that we're doing and the hope and safety. I mean, they have to know that they have to wear that mask. They have to clean their hands, that this is not a joke. And the same thing with my 7-year-old. I kind of bring it down on the level that, that he understands that, there's germs around and we have to make sure everybody's safe, and you have to mask and you have to do these things properly. And I'm sorry you can't see your friends physically, but here's a iPad. Let's FaceTime. And spin it in a positive that it will go away. I have to give him hope that it will eventually go away and this is going to be okay. And as long as you're safe, we're safe. We have a roof over our head. We have food. We're going to be fine. We're together. And, it's difficult. It's difficult. And I see it in them that, they have their ways of, when they don't want to talk about it because they're filled up with information. We try not to turn on TV too much because I don't want my kids to be exposed to a lot of negativity, because there has been a lot. So we kind of feed them information that we want them to hear.
Jack, have you heard from other healthcare workers, or what do you recommend for healthcare workers in dealing with family dynamics at this time?
Well, I think one of the things that the pandemic has done is really revealed a childcare crisis that we have in America, with the closing of childcare centers and schools and no real accommodations early on for parents. It really created a dilemma for many parents. They had to choose between caring for their child and going to work. Some healthcare workers left their jobs in response to this. So it's been a very difficult time. One of the things that we've learned is that each family had to make their own adjustments to the pandemic. They had to make their adjustments either at work or in their family, sometimes because they have elder care responsibilities as well. And they had to find a way to make that part of their life, which meant that they had to kind of create a new scaffold of routines and structure that the pandemic stripped away. And early on, that was very difficult for people. You go a month or two into this, our routines were really torn apart from us. And so we had to create those new routines. And those routines have now included, as Marima said, putting children in the mix in a way that was different than before, perhaps seniors, perhaps things that you can do for enjoyment or getting refreshed or renewed in some way. So that became a big challenge, and that's what families have had to figure out how to do. Those families that have really reflected on this, created a plan of how to do this, are doing better than families that are continuing to assume things are just going to get better, because it's going to be a while before that happens.
Jack, what have you learned during the course of this pandemic?
Well, I've really come to understand what the term loving kindness means. I can't tell you how many times in town halls I heard that word. It's a word that comes from across the world in different traditions, religious and secular. But one of the things that I've learned is how much people during this time appreciate when they are the recipient of loving kindness, of forgiveness, of acceptance. It's made a big difference, because none of us are at our best right now. We're all trying to do the best we can, but we know we're not really going to be able to do the best we can for a while. And so to give each other a break, give ourselves a break. And I come to learn that about myself. I've come to see it in others that I care about. I certainly see it in the town halls. It's amazing to me when someone talks about the stress they're experiencing. They don't know if they can actually go to the work that day. And then someone else in the town hall says, I had that happen yesterday. That happened to me, and this is what I did. And that person gets some strength from that and is able to move forward and kind of go forward. It's been extraordinary to watch that. So I've learned loving kindness in a way that I didn't really fully appreciate before the pandemic.
Well, we appreciate all the work you do, both of you. Thank you so much for taking some time to speak today. It's so important that we take care of the people who are taking care of us. Thanks a lot.
You're
Thank
welcome.
you.
Thanks for having me.
Next, we travel to Hallen School in Bridgeport and meet a teacher who's supporting her students' social and emotional well-being during the pandemic and finding meaningful ways to manage her own.
My name is Alicia Price. I am an educator for the City of Bridgeport Public Schools. I am a parent, proud parent, educator, and community organizer. I knew I wanted to teach when I was actually working in the criminal justice field, and I would often come across young men and young women who had the capacity. They were intelligent, they were passionate, but for whatever reason they made the wrong decisions. So being a social studies and literacy teacher is absolutely a dream because I'm able to do both of my passions, merging history and literacy together. Take a moment and read it so we can have a discussion. I clearly recall getting a phone call from my daughter, which was a little troubling initially because she knows that I work, but her call was, "Mom, you have to come and pick me up within the next couple of days. They're kind of pushing us off campus." And I was like, wow. And then a couple of days later, that's when we kind of went fully into remote. If I'm being transparent, I was absolutely scared because I didn't know what it was going to be like. I didn't have a reference point. I'm an in-person teacher. I like to touch and feel and interact with my students. So this whole idea of remote learning was something new and different, and I was very anxious about it. Not only did I struggle, but the students struggled, and I believe families also struggled. You know, the whole idea of having everything be taught through the medium of a computer. We were kind of learning in action. The feeling of isolation, you know, you're working only from home, the students are only working from home. The feeling of being anxiety, not really knowing what was going to happen next with the pandemic, or, you know, am I going to see my teacher again? Am I going to see my students again? Am I going to see my friends again? There were so many emotions. There was frustration, there was anxiety, there was anger, you know, which I think everyone kind of experienced. I had to take a deep breath after I kind of yelled in a pillow a few times. I think my faith kind of, it really did. I'm absolutely positive that helped me and pushed me along. I understand the safety part, and I understand why we have to go into hybrid. If I had a choice, I would much rather be in school. I think that, you know, we're gonna have to work extra hard to just try to make sure that we keep students engaged, as well as, you know, managing their emotions and their feelings is gonna be a task.
Joining us now for a conversation is Alicia Price. Thanks, Alicia, so much for your story. And Mark Brackett. He's founding director of the Yale Center for Emotional Intelligence and author of the book Permission to Feel: Unlocking the Power of Emotions to Help Our Kids, Ourselves, and Our Society Thrive. Glad to have you both here. Welcome.
Thank you.
Mark, the Yale Center is partnering with the state of Connecticut, offering help for teachers and principals and staff who are dealing with this pandemic and the stress of everything and generally feeling overwhelmed right now. The course is free thanks to a grant from Dalio Education. Can you tell us a little bit about this?
Sure. In response to, I would say, the multiple pandemics we've experienced over the last 8 or so months, we felt the need to support our educators. You know, we knew from our research that before COVID, they were overwhelmed and stressed. And what we found during COVID, in particular, they were feeling just a tremendous amount of anxiety and fear and frustration. And we wanted to make sure we could support them. And we knew that schools might not be ready to do a big, systemic approach to social and emotional learning. So with generous support from Dalio Education, in collaboration with the governor, the commissioner, the teachers unions, the AFT, and the CEA, and many others, we built this course called Social and Emotional Learning in Times of Uncertainty and Stress. And it's a 10-hour course, or 10 modules, I should say, that are built to help teachers understand their feelings during these difficult times, understand their students' feelings, and importantly, have strategies to help themselves and their students.
Can we talk for a minute about stress? What is stress? I mean, a little bit of stress isn't bad, right? I mean, it can help you feel motivated or get things done, but when does stress become problematic?
Stress becomes problematic when it's distress. So in psychology terms, we say there's eustress, the positive stress, the stress that helps me stay focused during this interview, that keeps me on my toes and makes me think critically and pushes me to, win a karate match. And then there's the stress that makes me not want to get out of bed, makes me not want to go to work, etc. And we call that distress. And I think the way we like to think about it is in terms of its duration and intensity. So when you're experiencing stress, which means, technically having too many demands and not enough resources, when you experience that for too long and it's too intense, it depletes you. It depletes your mental resources, it impacts your immune system, and that's the stress that we want to prevent.
And why is it especially important for teachers and principals and school staff to pay attention if they're feeling stressed out?
Well, there's a number of reasons. The first is that it's just not good for your health. Certain neurochemicals get released when you're feeling this chronic stress. It puts you in that fight, freeze mode. It makes you vigilant. Cortisol levels in your body are going up and down, which is just not good for your physical and or mental health. So we want to make sure that we're addressing that. I think the second is something that's relevant to education in particular, which is that stress is contagious. There's something that's called emotional contagion. And so we say a stressed out leader is a stressed out school, a stressed out teacher is a stressed out classroom. And so we want to be mindful that our children in our classrooms are observing our teachers' facial expressions, body language, vocal tone, the words that are coming out. And if it looks frenetic and it feels scary, kids will take on those feelings.
Alicia, let's turn to you for a minute. You've been using some of the tools that the Yale Center has offered. How do they help you in the classroom?
Well, just as Mark said, just being able to take pause and take inventory has been helpful. Establishing the norms and the feelings that we want as a classroom has been tremendously helpful, because what that has done with establishing something like the classroom charter has made students more accountable for their actions and for their words. Just letting students know that it's okay to feel a certain way. It's okay if they start out in the red because they're frustrated, because something might have happened at home, or they're annoyed and they're in the blue because something might have transpired on their way to school. It's okay to be in that space, but what tools, what strategies can we start to use to move us to a more productive place? Maybe not yellow, maybe they won't be extremely happy that day, but maybe they will have a sense of peace and calm that would make them more focused, that could assist in them being successful for that day.
Alicia, you're a social studies teacher and a literacy teacher, but I wonder in particular how you're talking with your students, not only about the pandemic that we're experiencing right now, but this incredibly consequential moment we're living through between the presidential campaign, economic uncertainty, a national reckoning with racism and racial injustice. How do you teach this and still stay reassuring as students raise very valid fears and concerns that we all have?
I think the place that I come from is empathy. I think empathy is something that has to be taught and reinforced. And I think that's something Ruler supports. So again, I think talking about issues that are relevant to my students today is important. But I also think if you look at it through the lens of having empathy, is one way that we do it. Okay, so you're concerned or you're upset or you're angry about, something that you might have have seen or something that might have been experienced in your community. How can you take that energy and turn it into something positive?
Mark, Alicia spoke briefly about Ruler. Can you tell us what that is?
I would be delighted. So, Ruler is our center's evidence-based approach to social and emotional learning. We are in about 250 schools across the state of Connecticut. Bridgeport is one of our major districts that we've been working with for, I don't know, 6 years now. And it's a whole district or a whole school approach. And you heard Alicia mention these different tools. She was talking in color, like red and blue. That's our mood meter tool to help people build emotional self-awareness.
Back to this moment that we're living through right now, schools are moving back and forth between in-person and remote learning. Let's talk a little bit about that. How does that affect well-being, both for teachers and for students?
Well, I think, oftentimes we confuse, the building with the people. And I just want to say, I learned this from one of our principals in Ruler, right? Schools are made up of people. And we just need to remember that. It's about the relationships that we build, whether they're in person or whether they're through any kind of Zoom technology. And so all the tools of Ruler, when Alicia is doing a mood meter check-in with her students, it's so easy to do through technology. You can ask kids, what color are you in this morning? What's your feeling word this morning? What might be your strategy? Or do you need me to help you with a strategy? And so I think that we get overly concerned around, oh my goodness, we're not in person. When, we can connect virtually, we can connect in many ways.
Alicia, do you have a comment?
I was just going to add that even though we're in the age of technology and it does make the connection piece that much easier, I think that, it also adds to the whole idea of stress and being overwhelmed because, as an educator, I do miss my kids if they're not in front of me.
Yeah.
And I think that, unfortunately, in-person relationships are more important. But again, because we're in this place, we have to use the tools that are available for us. And as Mark said, I constantly start my day with putting the mood meter on the board and having prompts for the students to react to and they share out. So that's one way to kind of bridge the gap because they're not in person. But I do think it's hard because they're not with us. But again, we just kind of make do with what we have and try to make it work as best as we can.
Yeah. I would just say I want to echo, and I think there's no replacement for face-to-face, right, for human-to-human interaction. But one of the benefits, I think, of schools that have really done this work systemically is that they can quickly shift and use the tools remotely.
What have you both learned during the pandemic?
Alicia, I'll let you go first because I can talk for 3 hours about that.
Okay. I'm a teacher, so can I, Mark, but I'll make it brief. I've learned through this pandemic several things. I've learned to give myself grace. I've learned to be patient. I've learned to be extremely flexible. And I've learned that, at first you don't succeed. Try again. So those are some of the major things that I've learned. I've had to become very adaptable. My learning curve has been challenged, but I've also stretched myself. And through stretching myself, I've become, I think, a better person. I've worked through the challenges that this pandemic presented, but I think that I've come out a better person for it. I still have, I'm still on my journey, but it's made me more aware, and it's strengthened relationships. I mean, it's nothing like, having time to kind of just really work through yourself and on yourself and then build relationships with others. So I could say that, even though 2020 has been a challenge, it's also stretched me and it's had positive outcomes for me. I come from a place of gratitude, even more now. Mark?
Yeah, well, you said a lot. It's funny, when we did a research study during the pandemic and we asked teachers themselves, about their best selves, all the words that you came up with, like I need to be more, my best self is more patient, my best self is more flexible, my best self is more adaptable, and so you're living it. Um, for myself, a lot of times people ask me, well, how are you feeling, Mark? And I say anxious, overwhelmed. And, they're like, really? I'm like, really? Like, there's a lot of uncertainty. Why wouldn't I feel that way? I'm not going to just say I'm happy when I'm not. It doesn't mean I don't experience some joy and contentment in my life, but there's a lot to be stressed out about. And I think the power of our work is to give people the permission to have all their feelings. And just because I'm anxious doesn't mean I'm weak or I'm bad. And I think that's a really important message to everybody who's listening. Like, it's okay to feel anxious. It's okay to be stressed because
Right.
this is what is presented to us right now. But you don't have to allow that emotion or those feelings to have power over you. You can learn strategies on how to use those emotions wisely. And so, for me, I always prefer to be in learning mode rather than the knower mode. Professors are supposed to be the knowers, and I'm like, I'm still like, I'm a scientist in training about my own life and really about how to work with others.
Well, I want to thank you both for wise words during this very trying moment. Thank you both, and stay safe.
Thank you.
Thank you.
The coronavirus has thoroughly upended our way of life. It's reshaping our personal relationships with more time at home, less human connection with our larger communities of colleagues and friends. We continue now to New Britain and meet a single mother and her son. Like many moms, she's faced huge challenges juggling parenting and working amid a pandemic.
My name is Yola Sibor. I'm 31 years old. I've been living in Connecticut about 21 years, and I was born and raised in Poland. I'm in the cleaning business. I'm a housekeeper. My son's name is Brendan. He's 5 years old. So once the pandemic hit and at the point where the schools closed down, at that point I pretty much stopped working altogether. It was difficult, but also good at the same time. So I got to spend a lot of time with my son. Soon enough, he started getting very frustrated. It was pretty difficult for me as well. I'm not gonna lie, it was a difficult transition. So basically, I took on the role of a teacher almost. And it was difficult. I wasn't sure if I was doing it right, and just a lot of anxiety with that and stress. When the school started back up in September, my main idea was to keep my son at home. So my mom came in to help. For her, it was very difficult. She doesn't really have experience with computers, and it was hard enough to teach her her cell phone. So she did her best, but she was very stressed and frustrated as well. And then there's the language barrier from Polish to English. So it was just very, very stressful for her. She couldn't really do it any longer on a daily basis. So I did have to end up having him go back to school. It's great now, but it was very stressful to have to make that decision. So right now it's all art. Then it will be all gym or music. So yeah, all this every day. We got art every day. So I've been suffering with anxiety for about 6 years, and I've been coping with it on my own. Didn't really seek help because for me there was like a big stigma around it. I didn't want that on my record. But the stress got to me I was getting like five anxiety attacks a day at some point. My anxiety just kept building up and up and up. And then one night I had this big panic attack where I woke up in the middle of the night and I couldn't breathe. Yeah, it was one of the worst experiences of my life, I can say. And I've been through a lot. Since I couldn't cope with it on my own, I knew it was time to seek help, and that there's nothing wrong with that. I feel like your body will find a way to get rid of everything that's going on inside one way or another, and that was like the breaking point for me. Things are actually very wonderful now, a lot better than I could have imagined 2 months ago. I'm trying to stay as positive as I can, just grateful for everything that I have, and I know it could be worse. And another thing that really helps me is knowing that like, we're all in this together. So it's not just me suffering in one way or another. It's just everyone, the whole world. So.
Yola Sieber joins us now for a conversation. Glad you're with us. And here to talk more about how the pandemic is affecting parents and kids is Rocio Chang Angulo. She's a clinical psychologist and an assistant professor in the Department of Psychiatry at UConn Health. Welcome to you both. Rocio, we've just heard Yola's story. It's one of millions of stories of families living their way through this pandemic. The particulars can vary, but what kinds of common themes are you hearing from families and kids at this moment?
What I'm hearing for families like Yola is that there is a great uncertainty, many lack of routine, lack of structure, many other demands that are happening as a result of the pandemic. But we're also living other sort of major life events in families' lives that is disrupting their daily routines, that is disrupting everything that they are very familiar with.
I've heard people say that there are really two pandemics going on right now. One from which some people will ultimately emerge okay, physically, financially, and psychologically, but another in which people will continue to see devastating consequences. And the divide between these two is likely to fall along racial, ethnic, and socioeconomic lines. The state of Connecticut's reported that COVID infection rates in the Black population are double those in the white population in the state. Rocio, can you talk about the unequal impacts of what the pandemic has meant for the mental health of families?
That's a great question, and unfortunately, it's a reality for many families of color. They already were very familiar with all of these disparities, and now with the pandemic, and as a matter of fact, the syndemic, there are more families whose worst nightmares are here, and they are reconfirming again what they already knew, and now they are experiencing more devastation in their lives, and they are seeing that the people who they are the closest ones are the most affected, and also the ones that, and also as a parent, as a head of the household, many times the inability to protect their loved ones is such a reality, and it sort of impacts their daily lives and the way that they see the future too.
Yola, one of the striking things about your story is that you knew when you needed to reach out for help, and you did. Can you talk about that?
Absolutely. Well, I think everyone reaches a certain point where they realize you can't just do everything on your own and cope in your own ways, and you do need some outside help. And I strongly encourage everyone to do so.
Rocio, are more families reaching out for help at this moment?
I am actually glad to say that that's what I'm seeing, that there are families that collectively are supporting each other. And I have heard a little bit of Yola's experience, and I'm glad that she also was able to reach out. You know, there are communities of color now that they are gathering together through Zoom. It's a way of consoling each other, but also giving each other support and reminding each other that they have overcome many significant life events already, and that they are not alone, which is the best message that we can give to each other and fully support each other in front of these circumstances that is affecting everyone.
You mentioned that people are gathering together through Zoom, and of course technology has been so helpful in terms of helping us connect with families and friends and loved ones. But remember when we used to limit kids' screen time, and now we're asking kids to spend hours and hours glued to their screens? I'm wondering if we could talk about how this might affect social and emotional well-being. Rocio, should parents be worried about the amount of time their kids are spending in front of a screen right now?
Well, this is so new, right? Just recently, before the pandemic, I was actually being part of a gaming study where we were really telling parents that the average amount of time that kids could engage in gaming was no more than 2 hours per day. Now, I know that through the media and through research that we know that now is the times is much longer. And one of the things is how can we help our kids to gain back the structure and the routines, and in the midst of having all these limitations, right? Um, so what I advise is that we don't have really set rules, but we could all use our own judgment in trying to figure out what would work best for our kids, depending on where they are developmentally and depending on the needs, their emotional needs that they're expressing, day by day.
Rocio, can we just talk briefly about the relationship stress between adult partners? We're spending so much time at home with our partners and a lot less in-person time with our larger communities of friends and work colleagues. How's this affecting marriage relationships?
We're seeing that the stress levels in couples is off the roof, unfortunately, and that many times affects how we can relate to people that we really love, and also it affects how we can really use our healthy coping skills to deal with these stressors that are not going away, unfortunately.
And can you offer some healthy coping skills? What are the strategies you recommend to get through this pandemic?
Well, our grandmothers, our grandfathers were very wise. And I think that we all know that there are basic things that we all can do in order to help each other. So number one is how we can use the healthy coping skills that we have used in the past and have helped us to overcome different circumstances, how we can really make an inventory and think about those things. So for some people, they are deeply spiritual. And, obviously now even that has been taken away from us because we cannot really go physically to many places where we could get some peace, right? But there are alternatives, and there are ways that we can feel the connection again, even if it is through Zoom or through any other online services. So that's one. Exercise is very important, and those walk-ins, like Yola was saying, walk-ins in the park, going out, riding your bike, being in touch with nature, that's really important too. It helps us to calm down, it helps us to feel grounded. Many times, sort of thinking creatively outside the box about what are some of the things that we can do as a family unit, playing some games that we had never, because of all the rushing and going from place to place, we never had opportunities to do. That would be really important. Many times doing even the little things as baking or cooking together, basic things that can help us to know what is important and how we can enjoy each other's company a little bit more. The important piece, I think, that is also that every day when we wake up, we sort of remind ourselves what is really important for me in my life, right? And many times these things are basic things that we all value, right? Like the people who we love, our kids, our partner. So things that can ground ourselves to know that, we're doing the best that we can and we appreciate each other. There is something to say about being grateful for each day.
Yola, what do you do to be grateful?
Yes, I practice gratitude every day as soon as I wake up, and I think that's been a huge thing for me to overcome like any bounds of sadness. I don't ever stay in a depressive state for too long because I'm so grateful for everything that I have. And I do a lot of meditation. So we do a lot of breath work. And for kids as well, there's so many great meditative videos on YouTube. And he loves it. So they're very more interactive for kids. We also do yoga. He does his little yoga and he enjoys it, and it does seem to help. And also we do Reiki. I do Reiki on myself and on him, and it helps us at the end of the day to de-stress, and it's been working very well.
Well, I want to thank you both for wise words during this pandemic, for your thoughts, and stay safe.
Thank you.
Thank you so much.
Next, the story of a Simsbury artist whose family suffered tremendous loss early on in the pandemic. She talks with producer Christina DeFranco about ways creativity has helped her cope with the grief.
Well, early on with the coronavirus, my mother-in-law became sick, and a few days after that, my father-in-law became sick. And my mother-in-law died of coronavirus, and my father-in-law was sick for a very long time. He stayed positive for 64 days. It was so early, this was April, and nobody knew how long the virus really lasted, and there was a lot of fear. So before we really knew what this virus was all about, the stress in our family was very high. Well, to get through it, I made time to paint. My daughters are also artists, and we created things together. We would sit down at the kitchen table and we would make art. My daughter made terrariums, and my other daughter made sourdough bread. Doing anything creative just makes you feel lighter. I painted as often as I could with my daughters, and we hiked a lot in the woods because being outside just made you feel better. I'm an active member of the Connecticut Pastel Society, and we have Zoom meetings every couple of weeks, and we sort of check in on each other and make plans for the future. And everybody was feeling down, kind of tired, without motivation. And so we decided that we would spark everyone by trying to promote a Paint Outside Saturday. With all of us, when you're feeling generally down, it's hard to gear up for something even when you know you enjoy it. And it does take a push, it does take some conviction to go out and do what you love to do. When I come out here, I feel at peace, and I feel like I'm doing something I know how to do, something familiar, and it makes you feel good. My daughter said through the whole beginning of the coronavirus that the sound of rushing water made her feel calmer, and I agree. He's good now, and we're thankful for that. And we're able to sort of put life back together again, but we will be forever changed by this virus.
So, what are other Connecticut residents doing to cope with COVID stress and uncertainty? Let's hear more.
My name is Danielle Ternulo. I'm a clinical mental health counselor, and my profession is working with the mental health and substance use population. I try to not bring work home with me, so I come to Pure Barre actually to de-stress and to be able to kind of let it all out, clear my head, and then get back on track the next morning.
I do walk around the block in my home, and as you know, at work, in my limited time, lunch break, I got out to get some sun.
I like to go fishing every day when I got free time. Go get some blackfish, porgies, bluefish. It's the only way I got to stress out my mind.
I haven't gone outside at all. I just go to work and come home. And that's it. And it's like I'm so happy to be with my friend, to be outside. But I'm trying to be mindful, be happy, try to talk to my old friends again.
I actually live with mental illness. The last year has been a complete roller coaster, and COVID hitting has totally changed a lot in my life. But I always know I can get on the bike and burn it out.
The pandemic is not over yet. This month, the United States has been setting daily records for COVID cases, and public health experts say we're just entering what may be the toughest months in terms of infections nationwide. What are you doing to build resilience and stay mentally and emotionally strong? We'd love to hear from you at ctpublic.org. And don't forget, there's support out there. If you'd like to find out more on how to address your own mental health needs or those of someone you love, visit ctpublic.org/community-resources/coronavirus. Finally, please remember, we're all in this together. You're not alone. This is Cutline. Thanks for joining us. I'm Diane Orson.
Funding provided by Hartford Healthcare Behavioral Health Network.